Some people are confused about when to use ice and when to use heat when they have an injury to a wrist or an ankle. You need to use ice as soon as possible after damaging your limb. If you apply it immediately, it will help reduce bleeding in the tissues and will reduce the swelling and inflammation. You must never apply ice directly to the skin because it can burn, similar to frostbite. The best thing to do is to apply a little oil and then a wet flannel before applying the ice. If the skin is broken, then just use a plastic bag to protect the area. Check the colour of the skin after about 5 minutes. It should be bright pink or red, and at that point the ice can be removed. Don't keep ice on longer than 20 to 30 minutes. Heat should not be applied to the area until at least 48 hours has elapsed. If you do go over on your ankle, remember rice: rest, ice, compression, that's a support bandage, and elevation. Keep the limb raised. If you do this right away, then your injury will not nearly be as bad and will heal quickly.